All right. Hearing none, ladies and gentlemen, this is the time for public comment. Our rules are posted along with the agenda. Sorry. Oh, I checked that off already. Sorry about that. Review and approval of the meeting minutes from June 6th. Anyone like to make a motion?
I will make a motion to approve the minutes.
I'll
Move-
support.
Moved by Commissioner Levanway, supported by Mr. Rubing. Any further discussion, additions, changes, corrections? Hearing none, Mel, can we have a roll call, please?
Commissioner Chamberlain,
Yes.
Commissioner Ginnup,
Yes.
Commissioner Hankins,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Mason,
Yes.
Commissioner Rubing,
Yes.
Commissioner Turnbull.
Yes.
Thanks
Motion
for
passed.
keeping me on task there, Josh. Now, public comment. The rules are posted along with our agenda, ladies and gentlemen. If you'd like to address the Board of Health. I didn't get a sign-up sheet this time. Thank you, Shannon. Thank you very much. Okay. John Swartout. Good morning, sir.
I think your mic's off, John. There you go.
Thank you.
I want to start by recapping and emphasizing some of the things I said at your June meeting. On January 28, 2020, 9 days after the first American COVID-19 case was reported, Anthony Fauci said on national television that the NIH and many of its collaborators were already working on developing a vaccine and proceeding as if we will have to deploy a vaccine, even though about a third of common colds, which have been around forever, are caused by coronaviruses, and nobody has ever come up with a vaccine for that, in part because they're known to mutate quickly, despite the enormous profit potential. Reason one to be skeptical and maybe even suspicious. 3.5 months later, on May 15th, Trump announces Operation Warp Speed. Wait a minute. Fauci said he was working on a vaccine in January. Why did it take Trump 3.5 months to get around to greasing the skids to speed this anticipated miracle cure to market? Reason two to be skeptical. Operation Warp Speed, a business, government, military partnership to, quote, produce and deliver 300 million doses of safe and effective vaccines, unquote, within 8.5 months. 8.5 months. When the experts, even Fauci, said minimum 12 to 18 months and far more likely several years. 100 days before FDA gave Pfizer an emergency use authorization, CNN said past vaccine disasters show why rushing a coronavirus vaccine now would be colossally stupid. Reason three to be skeptical. There are those words, safe and effective, right there in the Operation Warp Speed announcement, as if the vaccines had to actually be safe and effective to justify the indemnification against liability that Pfizer and Moderna and Johnson & Johnson were given. But how can anyone know the vaccines are safe when nobody had more than 11 months experience with them? Reason four to be skeptical. To administer a treatment under emergency use authorization requires informed consent. But what information was provided? Virtually none. And how could anyone presume to provide the information required to obtain consent
30 seconds, sir.
when the FDA concealed damning information provided by Pfizer in its application? You can read those Pfizer documents for yourself at dailyclout.io. Reason number 5.
Would anyone else like to address the Board of Health? Yes, ma'am.
Good morning, Ange Duncan, can you hear me?
Yeah, go ahead and speak up if you would.
Okay, so Ange Duncan, I'm here for myself and also representing Center for Change. Ask me to let you guys know that. I just wanted to talk about the grant that's on the agenda today. There was some question about it at the Programs and Evaluation Committee meeting, and I just wanted to say, I went through their social media, the center or the Charlevoix County Community Foundation, right? It was, it's been a little bit, but everything on their social media, everything on their website, anybody that's donating to that foundation is in full awareness that these are the kinds of grants that they'll be going for. So if your argument so far has been to or has been government overreach as far as letting these grants through, I just wanted to make sure that you are aware that that's what the people that are donating to that foundation are expecting to donate to. So blocking that grant would kind of avoid that government overreach argument. So anyway, just wanted to say that. Oh, thanks.
Thank you. Would anyone else like to address the Board of Health?
Mary Lieberman, Emmett County. At the July meeting of the Programs and Evaluation Committee, I had the opportunity to hear the presentation from the Health Department for an opportunity to receive grant money from the Charlevoix County Community Foundation in the amount of $927 to provide postage for communication to be sent out to SNAP recipients. Basically making them aware that they can take advantage of using the farmers markets locally, and obviously a great opportunity to get good nutritious food for their kids and families. At that meeting, I was a little bit perplexed to hear that the representative from Antrim County, Commissioner Rubin, was adamantly opposed to this grant. However, it passed with the other commissioners that were there. I'm looking forward to hearing his explanation because I truly don't understand why you wouldn't support a program like that. But fortunately, the whole board will get to review it here in a few minutes. I would like to compliment Mr. Mapes, who represents my county, and Commissioner Ginnep. I brought this up at our commissioner meeting, and I look forward to them providing their support today for that grant. Thank you.
Good morning, everyone. My name is Rebecca Otto, and I am a resident of Emmett County. I am also the Director of Regional Community Impact for United Way. Before I give you the information that I had planned to give you, I wanted to address the grant that she brought up. The communication that was settled on as the best way to reach SNAP recipients wasn't done lightly. And it was actually a topic of communication with not just health department staff, but also with some other community groups, including the Local Food Alliance, which focuses on the local food shed and how to best reach people so that they can get access to the food that's available in our community. So that was settled on as the best way to reach them. It has worked in the past. It seemed like a low-hanging fruit, very cost-effective way of getting the word out to everyone. So as you consider that, please take that into account. Lots of people have been already in communication and evaluated the efficacy of reaching out that way. But what I actually wanted to talk to you about was the ALICE numbers. As I've said to you before, ALICE is asset limited, income constrained employed. Those are your constituents who are below a household survival budget. So that takes into account those that are below the federal poverty line, as well as those who don't make enough to survive in your counties. So I thought I would give you the numbers for each one of your counties. Antrim County, you already got this presentation, but I'm gonna give you the numbers again. So you have 10% of your constituents who are under the federal poverty line. 29% of your constituents are in that ALICE bracket where they don't make enough to survive. So total, you have 39% under the ALICE threshold. 39% of your constituents do not make enough in your county to survive living in that county. For Charlevoix County, your numbers are 9% below the federal poverty line, 27% in that ALICE bracket, for a total of 36% of your constituents not able to survive in your community. Emmett County, Your numbers are 9% under the federal poverty line, 24% in that Alice bracket, for a total of 33% who cannot survive. Otsego, your numbers are 11% below the federal poverty line, 27% in that Alice bracket, 38% of your constituents not able to survive. These numbers are with pandemic supports in place and numbers actually looking more optimistic than they had in previous reports. This next report that's coming out will be after all of those things expire, including things like
30 seconds.
the eviction moratorium. So we anticipate that those numbers are going to be worse. You can rest assured that I will be back as soon as I have more numbers, and that I will continue to remind you to make decisions focused on those people that are most underserved in your community. Thank you.
Would anyone else like to address the Board of Health? Yes, please. Can you aim that microphone down a little bit at you?
My name is Lou Ann McKinney. I'm from Antrim County. And I want to thank the Health Board for all of the things that you do to support the people in these 4 counties that really need assistance. It helps bring inequality to light. And I'd like to ask Jairus, who is one of my Antrim commissioners, do you not like your farmer friends?
Would anyone else like to address the Board of Health? All right, public comment is now closed. Staff reports, Mr. Thorell,
Yes, thank you.
you have 3 minutes.
3 minutes?
I'm just
Perfect.
kidding.
Perfect. All right, I better get started. So looking through my report for this month, workforce development survey was distributed to our workforce. And we had pretty good amount of respondents out of our 168 employees, roughly 100 respondents. And some interesting information that was gleaned out of that. Mainly, some of the things that stick out are how long have you worked at HDNW? And a vast majority are under 10 years, and even more are, as far as percentage goes, are 1 to 5 years. So we have a pretty new workforce. And then your highest degree attained also shows that we have a highly educated workforce, with most having bachelor's or master's degrees. Which is not completely surprising since we employ a lot of medical professional positions and behavioral health positions, environmental science positions, which is kind of outlined on that degree examples. And when you're looking at that type of diagram, the bigger the letters means the more respondents chose that as their profession. So nursing by far is the most there. So excuse me. And then the next question was asked, are you planning on leaving the agency? Which most said no, which is good for us. However, we do have some that are retiring in the next 5 years. And one of the things that we're looking at as part of my leadership plan, moving forward, leadership development plan is doing some succession planning just to make sure that we're kind of bringing up those employees from the lower ranks, grooming them, giving them the tools that they need to succeed to, potentially fill future, leadership roles. So that's an important thing that we want to look at. And just, all in all being better at training and also develop that competent workforce and keeping in mind at retention as far as going forward, because it's expensive to hire people and recruit and do all that types of things. So just one of the last things there, areas of additional technological training that they'd be interested in. Apparently we need to do some training on spreadsheets because that really stood out, which I don't disagree with because I struggle with that too. So we're actually looking at doing some of that training in the future. And just a really useful survey to kind of gauge where our workforce is. And we're actually doing some more surveys in the future to gauge the well-being of staff and just try to really tailor, what we're offering staff as far as, training and, how we can better understand our staff and where they're coming from and what their views are. So, more to come on that. So going into my highlights for June and July, as you are aware, we've been involved in a couple of lawsuits stemming from the masking order from August of 2021. These, as these cases proceeded through the local lower courts, the masking order was lifted during that time in February of 2022. And at that point, it was considered moot. And that was what our attorneys argued. And the lower courts or the local courts agreed with that. The plaintiffs appealed those decisions, saying that, arguing that basically the health department can issue another order, whenever. While technically, that is true. The argument was, well, the pandemic had shifted and things were improving, and so that wasn't going to happen. So anyways, on June 14th, the Michigan Court of Appeals agreed with the lower court that the Let Them Breathe case is moot. So that one should be done. We are still awaiting oral arguments date for another case that is exactly the same from the concerned parents of Emmett County. And, if that case remains dismissed, then the lawsuit, like I said, should be over with, unless the plaintiffs want to carry it even farther and ask the Michigan Supreme Court to hear those cases. Hearing what some of the board members have said about that, my own feelings about it, and the amount of funds that have been spent on defending these lawsuits. If that were to happen, then, I've already been in conversations with Michigan Department of Health and Human Services for them to basically take that case on. So we're out of it. Because at that point, it's no longer a local issue. This is becoming much bigger and it's a statewide issue. And, my opinion is that, that we shouldn't have to be flipping the bill for that. So that's what I know so far. Does anybody have any questions on that aspect?
Ruben.
Yeah, I see in the bills, a couple bills to Foster and Swift.
Yeah.
Does that have to do with this case?
Yes.
Or was that something else?
Yeah, Foster Swift is the firm that is exclusively handling these cases. And this was under our previous attorney, Lisa Vogler. She did not have the capacity to handle this. So it was basically given to Foster Swift to handle. And they're the ones that have been exclusively working on this. And then, like I said, when it's done, it's done. We're done with Foster Swift. That should be the end of it. Okay.
Any other questions? Go ahead. Dean.
Okay. So moving on, I'm happy to report that the state budget passed a $25 million increase to essential local public health services, which has been a long time coming. The public health code has, mandated that there should be 50-50 cost sharing between the locals and the state. And it really has not been in place since the early to mid 1980s. So this is more or less catching us up for the 8 mandated essential public health services: food safety, drinking water protection, on-site sewage regulation, hearing services, vision services, STD control, and prevention, immunizations, and infectious disease control. So that is a good thing that the state is kicking in their fair share. Although, $25 million, we were hoping that it would be more, but this is also spread out amongst all the 45 health departments throughout the state. And there's a funding formula that they are working on because it's based on population, and there's, new census information since the last time this was done. This essentially brings us from 45 million to 65 million for this funding statewide. So and that is where we are as far as that goes. We should know by late August, early September, hopefully, what that funding formula looks like and how much we will be receiving. The legislature did also approve distribution of infrastructure and workforce development funding. of $80.8 million for local health departments. It's going to be the same thing. There's going to be a funding formula. These funds can be used for important infrastructure, physical infrastructure for buildings or whatnot. And then it can also be used for staff recruitment, retention, and development. And some of those things I was talking about, it's been useful for covering training and conferences. And then some of those things that we were talking about with some of the survey of staff, looking at those training needs and whatnot. We anticipate using that funding for that, but also we have a long list, facilities list. Our buildings are aging. And it's always, a cost to maintain these buildings, which I'm sure being county commissioners, you can all relate to that because buildings are expensive and you have to maintain them. Otherwise, they become more expensive. Going on to the next bullet there, the community listening sessions, concluded in mid-June, and our consultant, Dr. Krantz, is working on the report. We're hopeful that we would be able to share that, have her come and present here and release the report at this meeting, but it just was not ready. So we are going to be doing that at the next September 5th meeting, Board of Health meeting. And that's basically all I have to say about that for right now. So more to come on that, which will be at our next meeting. On Tuesday, July 18th, Torch Lake Township unanimously passed a septic inspection and transfer ordinance. This ordinance, which goes into effect 180 days after passing, although I've heard some other information that it may go into effect 30 days after passing. I don't know, Jeremy, did you get confirmation on that? 30 days. Okay. Okay. Well, in their actual ordinance that they passed, it said 180. So I'm not exactly sure why it's different, but that's what we're finding. So it requires septic systems in Torch Lake Township to be evaluated by the health department when property transfers through a sale or other transfer. It also requires a one-time baseline inspection of all septic systems within 500 feet of a water body. Within 3 years of notification by the township. So there's a 3-year period where that needs to be done. And both the time of transfer and baseline inspections are exempt if the septic system was installed new within 10 years or was evaluated within 5 years prior to the transfer or passage of the ordinance for the baseline requirement. So the health department will be we're working with Torch Lake Township to identify all these properties within the 500 feet. And then also we have an intergovernmental agreement, which is in your packet, between Torch Lake Township and the health department, basically just spelling out the responsibilities of each entity as we work through this process, which we would need action on for the board to consider and approve. It basically just, we wanted to have rules in place similar to the Milton Township intergovernmental agreement. Just, okay, this is what you're doing. This is what we're doing. And it's all in writing. So there's no, so it's very clear between both entities.
How's that gonna affect the number of inspectors? I mean, do we have any idea how many systems you're looking at, Jeremy? Yeah. Thank you.
Yeah. And Jeremy, what was the number of like property sales or transfers? Yeah, and as you recall, or maybe not recall, but I'll remind you, we did add a environmental health staff person because we had that huge year in 2021 where we just couldn't keep up, and you were probably hearing it from some of your constituents that it was taking a long time to get a septic and well permit process. So we did add a staff person, and now the numbers of, they haven't dipped significantly, only by like, 10% maybe. We have the staff to be able to handle this. If we'll evaluate, over time. If we need to add somebody, then we will add somebody. But we don't like doing that as long it's, because we want to know that we can keep them employed. We don't want to hire somebody just to lay them off a year later or something like that. So we do take a very conservative approach to that.
Thank you.
Yeah.
Ms. Levan, we had her hand up.
Are you done with your report?
Yes.
Okay. I wanted to ask you a question. In Antrim County, we have Elk Rapids Village that also has that. Do we have an agreement with the health department on that?
I believe we do.
Okay,
I
so
believe-
all three of our municipalities in Antrim County that do this, you have an agreement with.
Right. And I can't say that. I'd say I believe we do. Do you know, Jeremy, do we have?
Okay. that's King. Okay. And we do charge. It's not.
Oh,
for
yeah.
free.
Yeah.
Yes.
No,
So
we do.
People are familiar with that. It is a cost.
There is a cost, yeah. So there is a fee, and it's an existing system evaluation. And yeah, we charge a fee for that, and that, covers our staff time, basically, and the reporting and everything else, so.
And
Again,
it's about $460,
346.
346.
The other question I had is, when the state's giving you more money for infrastructure and for more funding, is that just 1 year that we know of?
That is actually over 4 years.
4 years?
Yes.
Both of them?
No, well, so the $25 million increase in ELF's funding, the Essential Local Public Health Services funding, that's year to year. I mean, that's with the
So it's
budget. I
just
mean,
for 1 year.
next year they could, pull back
Pull
and
back on that
say,
too. Okay.
hey, I hope you enjoyed that 25 million, but this year we're gonna take that back and cut you another 10. So I mean,
Right.
yeah, we don't know.
And
but
the infrastructure is for?
the infrastructure one is over 4 years,
Okay.
Mr. Mason.
but not, the 80 million, 80 million over 4 years. It's not 80 million
A
per
year,
year.
okay.
Right, yeah.
Jeremy, now, are these types of inspections, like from the winter slow, are you able to perform that kind of inspection? Well, we had to.
Mr. Rubin.
On your employee survey.
Mhm.
So we have 68 employees that we didn't get any information from. Is that correct?
Correct.
Did you break it down by, like, we have a number of employees under environmental, we have a number under, oh, my mind just, you can. tell me.
The other divisions, right?
Yes, the
Yeah.
family and women and infants, and
Mhm.
was there a greater degree of participation in one over another, or have you discussed with your division directors how to get better participation? Because this is good information to have. I mean,
It is really,
I don't suppose you can tell them that to get their next paycheck, they have to fill out the survey, but
Yeah.
I mean, as an employer, knowing what your employees want or are planning is really beneficial.
Yeah, it's a really good point. And I mean, we can always run the survey again. What I'm suspecting, and especially with, the degree example being nursing standing out, is most of the respondents were in the family health and community health division. It's tough to get sanitarians to commit to it when they're super busy with permits and whatnot. To get to them to commit to a survey. But I will say that, having 100 respondents, out of 168, it's really good from a survey standpoint when you're doing a survey. If you have any more than half of the number of people that your target number, I mean, that's a huge win as far as surveys goes. But I agree with you. I think the more, I think we should do this again and try to get, just keep doing it to keep gauging, at least maybe every once a year to keep gauging this and keeping an eye on it, because it's good information. And one of the things, as I was looking this over, and it's something I'd like to have our HR staff do, is some of these, we can get the numbers, right, just from our own data. We don't necessarily need a survey to get it, like how long someone's worked at HDNW, or, what their highest degree is attained. They may have to go in and look through the files. It may take some time, but we can get some of that information that way.
It would be nice to have like a percentage of under each division, like environmental, how many, we had 50% that gave their information, and under family.
Yeah.
We had 60%,
That would be interesting. I
Yeah,
agree.
that.
Yeah. And we can break it down like that. Okay. All right.
Because the
That's
other
good.
thing is, if I'm an employee and I fill out the survey and then you send it to me again,
Yeah.
that's annoying. You know what I mean?
Oh, yeah.
I just
yeah.
filled this out.
We don't
So if
wanna-
you have a couple divisions that are like in the 80 to 90% range. Well, we got pretty good information there. If you got a couple that are in the 30 to 40% range, well, then maybe we can target that.
Yeah,
You know
that's
what
a
I mean?
really good point. That's a really good point. And maybe we give the survey to them again, but not the others.
Right.
Yeah.
Any other questions for Mr. Thorell? Okay, hearing none. Get back to my agenda here. You have written reports also from a number of our directors. Anyone have any questions for any of our directors? Mr. Rubin?
These, we have several pages here under provider update,
Yes.
and that isn't specifically any director, is it? Or,
It's Dr. Meyerson's provider update. Yeah.
okay. And I see in the middle that we have 6 months worth of data on 3 different health departments on, I guess, basically anything that they're seeing. And I was just wondering if, did you present this to us last year? Or is this something new? I don't recall it from last year, but I'm just wondering if you could, did you pick these health departments because they're near us, or how did this come about?
Sure. So the provider update is a newsletter that I try to get out to area providers, the doctors and mid-level providers and the hospitals in the region. And I represent those three health departments. So that's why they're there. Trying to provide, to minimize, to have one update that covers all 3 health departments, especially because a lot of our health networks that I work with, like Munson, for instance, or McLaren, they go over, they cross jurisdictions, but there's a lot of overlap there. So the provider update is trying to provide what I think is good information for them to know, to improve that communication between the providers and the health department. And then the communicable disease report is those are the reportable communicable diseases that are reported to us from laboratories and physicians. And so I like to then, close that loop and make sure they're giving me information, they're reporting diseases to us, and then we can share back with them, well, here's the information that you provided us, so they can see, what is going on, what's circulating in their community. In the winter update, I usually provide them like a 5-year data. It's something that's, part of accreditation to make sure they see what the 5 years are and the trends. This time being the summer, I kind of gave them that this was the 6 months the kind of year to date, what diseases have been reported to us by them. And that's what that is. And I do it by health department because there can be slight differences in communicable disease rates. Benzie-Leelanau, for instance, generally has, more, we can see tick-borne illness in all of our counties, but they seem to have more of that. So I separated it by jurisdiction.
And do you have approximate population? Because that can, I mean, I
Oh,
know,
well,
I
sure.
know our
Yep.
health department is 110,000 people roughly.
Yep.
But Benzie-Leelanau, I'm guessing is quite a few less than that. So that,
Yeah, and I guess I made the assumption that most of the physicians know the population of the area they serve.
right. So do you know
yeah.
roughly what Benzie-Leelanau population is compared?
Yeah, I think their census is around 60.
Okay. And what about,
District 4 is around, I think they're around 70 now.
70% of what?
70,000
70
people.
Okay.
Yep.
And then,
75.
and I just wanted to comment on this, expedited partner therapy. I've never seen anything quite like this. If you go back and you look in the book of Genesis, God says that his design for the family is one man and one woman married for life. And that you can get a prescription for a possible sexual partner and you don't even have to list their name or their birth date. I just can't quite understand that, because if you're getting a prescription, I mean, can you imagine if you went for an antibiotic and you said, I need an antibiotic for a person and you don't have to give their name or their birth date? I don't understand that.
Okay, do you have a question, Jairus?
I don't know.
Okay, thank you.
Mr. Mason. So along the same line, the expedited part. So there's obviously some kind of enforcement here. Is the health department paying for these special prescriptions that you would get for your partner, and what is the health department to do with this?
Mr. Mason, can you move your microphone up a little bit for you? Thank you.
So what does, is there a cost to the health department for endorsing?
I don't think there's a cost to us endorsing it. We do provide treatment for sexually transmitted infections. It's one of the essential mandated services. So we provide treatment for anyone who comes to the health department and is diagnosed with a sexually transmitted infection and they require treatment for it, for chlamydia and gonorrhea specifically. We provide those antibiotics. We get that medication through the state. It's actually a mandated service. It's not we can do it or shall do it, but we must provide that treatment. But expedited partner therapy is a different issue. And in fact, all 50 states now allow expedited partner treatment in some sort of fashion. Every single state does it. And the whole idea is Jairus may not understand it. You might not like it. I may not fully comprehend it either, but the reality is that we have sexually transmitted infections. And if you look at our report, it's one of the most commonly reported infections to the health department. So whether we like it or approve of it or not, it's out there, and it behooves us to try to provide timely treatment for it, because if untreated, it can cause significant problems. Women who have untreated chlamydia over time, it's one of the leading causes of infertility, so that when they may try to have a baby at a future time, they'd have difficulty with that. So I think, these are important health issues that, again, whether it doesn't matter, what our approval is, it's out there, and it's a mandated thing that we try to control the spread of communicable diseases.
Ms. Levanway.
I just wanted to make a comment that the people in the audience may not know this. there's a really good database called fire.airnow.gov. And through all that smoke that was in the air, people at where I work were coming in, oh, it's so bad outside. And this helps so much information because they may be downstate and they heard something different than what is here. So it's a really good database to look at when we had all the air quality issues. That would be very helpful for people. I thought that was great. Thank you.
Thank you. I think we had moved on from Mr. Thorell. Is there any other questions for any of our directors?
I guess so. I don't know who's in charge of the safe.
That would be Kathleen
Okay.
Jakanovich's division, community health.
So you see this here, it says 83% of youth in our region don't use weed. This morning when I drove in here, I saw, I think it was a Charlotte County transit that had that on the side of the bus, transit bus. Personally, I don't find that particularly encouraging, nor am I sure that that's a great message to be giving to youth. That's telling me that 17% of youth are using weed. And as a dad, I tell my kids that just because your peers are doing something wrong doesn't mean that you should do it. And so I encourage them to think through their actions. And even if the majority is doing it, I encourage them to take a stand and to do the right thing. So whether it's in the majority or not is not the issue. We need to do the right thing, whether it's popular or not popular. So I don't know. I just think that we need to have some sort of a different message for that. That's just my.
Can I respond to that? Can I respond to that? I just want to make a comment. Kathleen, maybe you can say something. If you go to the show, you see these commercials in the show all the time about safe. Exactly what's right. Jairus just said. I went to the Alden Days over the weekend, and we had a DARE officer there with a church handing out safe information with bags and all different kinds of information, pamphlets. It was really, really good. And I guess that's my question, is that this does not say anything about that, is because it seems like the safe program is more involved with a whole bunch of people. It's not just a health department. And I kind of wish that would have been in here, because it doesn't list that. It says schools on the next page, but it doesn't say more about it, about what people do and how they go to events, and they educate the people all about the different kinds of things, how to prevent drugs and things like that. And it would be really nice if that was promoted in here. And I don't know if you want to say something, Kathleen, about that or not, to educate the people here more, because it's not just a health department.
I don't think it's on.
Power button at the bottom, mute switch in the midway.
There we go. So SAFE is a coalition. It's not just the health department and the community partners that are listed on the back. It is just more than schools. There's Harbor Hall and many police, sheriffs, Tip of the Mid Watershed Council, Northern Michigan Regional Entity, the hospital systems, MSU Extension. So there are a variety of partners that are within that coalition. They meet on a regular basis to discuss these things. A lot of the messaging is youth driven. So they're the ones that are kind of helping to decide like what they would respond to and what their peers would respond to. This flyer really that's in here is just a 2-page kind of quick overview of it. There, SAFE does have I want to say it's a quarterly newsletter that goes out with more partners, more of a partner update and more of what they've been working on over the last quarter. So I can definitely send that out to the commissioners, I can send it to Melanie to have it forwarded to everybody so you can get a look at that.
I think going back to, in what Kathleen just said too, and going back to what you were saying about this, the 83%, this is all the messaging, like for something like this is youth, like the youth group, the youth they make the decisions on how to present that messaging. And that's kind of like part of engaging them in the whole process. You know what I mean? So, and we try to like, it's kind of like adult guided, but youth driven. But I think that's some good feedback that you brought. I mean, really, whether it's your peers are doing it or not, it's, what is right or wrong, I mean, that's, something that's a baseline, basically.
Yeah, I was just talking to Mr. Chamberlain before the meeting, and now that weed is legal, a lot of these kids see adults, aunts, uncles, maybe even parents do it. So why can't I do it? Or why shouldn't I do it? And
Well,
it
well-
seems to be more and more of a problem.
Well,
Yes.
they have that to deal with, as well as the, alcohol too, right? So it's just another thing, another, obstacle, another, I guess, pitfall that youth can fall into. So, I mean, that's the whole reason behind this group is just try to give them the positive path, so to speak, and stay away from those things.
So I'm one of the adults that volunteer my time to help lead these youth, which is the entire reason for the coalition, because as parents, we can go into the schools and we can say all these things and it doesn't make any sense to the kids and they don't love it. This specific normalizing trend that we did was brought by the kids, because what they're hearing is everybody's doing it. And that's exactly what you said, the majority. So what the kids wanted to show to their peers is that the majority are not. So when they look at who is using and who's not, you don't have to be pressured to do it because the majority of people aren't using. So they were trying to help kids feel like you aren't the one that's out here on your own. Most of us aren't using. And the kids really felt that was powerful and what would impact their peers the most.
All right, thank you. Does anyone else? I have a couple of comments, so I'm trying to let everybody else have the floor for a moment first. Anybody else have anything for any of our directors? Okay. Quick question, and perhaps Dan, you answered this with the listening sessions. But in Dr. Meyerson's provider update, talks about the Citizen Advisory Committee. And I'm wondering if the Board of Health is going to have any type of informational feedback from this group. Okay,
Yeah, I'll let Holly answer that.
everybody's passing the buck.
So you're curious if the CAC is going to have any,
Are we going to know what
Communication.
they know? Are we going to know what their questions are? Are we going to know anything from the Citizen Advisory Committee?
sure. I think that's something that we're willing to share, and the Citizen Advisory Committee has been really a wonderful group of people that have shared very honestly and openly with us as the health department about things that have gone good, things that have gone bad, potentially looking at a COVID after action report. And there is a lot of things that Janine is trying to do with the Citizens Advisory Committee. And right now, since the beginning of this, we're really trying to introduce them to what the health department is and does. We're touring different facilities, and letting them get comfortable and build trust so that they can speak openly to us if it's something that maybe went bad in the past or is going great in the future.
I think it gives us an opportunity, Holly, to hear from our constituents through
Sure.
through another means, because while in the past we've had a packed house here,
Mhm.
we don't always. And because sometimes, our meetings are during the day, people can't
Mhm.
necessarily attend due to work schedules or other commitments. And I think it would be good for us to hear what the thought process is from some of our constituents as well.
Sure.
And that, and
I'll
that,
just, oh, go ahead.
and that advisory committee is for 2 years? Or is it 1 year?
We suggest a commitment of 1 year if they can do so. And then if they're willing to stay on longer, we would appreciate that.
Yeah, I'll just give a really quick example. I mean, this is just a really simple example. The Citizens Advisory Committee, but Janine gives them an assignment, they meet once a month. And she gives them homework to do, to bring to the next meeting. And one of them, a meeting that I happened to sit in on, their task from the last meeting was to look at our website and tell us what we think. And we got a lot of great feedback because, being an employee of the health department, we know where stuff is. We can find it, and, we know it's not the greatest, but to have outside eyes looking in and tell us like, hey, you might want to consider changing this because it's really crappy. Like certain portions of the website. And we immediately, we got that feedback and we immediately made, some of those changes that we could for the better. So it's been really, I think, just even little, simple things has been really useful to us to get that feedback. So.
Mr. Rubin.
Yeah, another question, and this is mostly for Jeremy, I guess. On the beach monitoring, how do you decide which beaches are monitored primary and which ones are monitored secondary? Because that depends a lot on how many samples you take during the summer, correct? Okay. Do you know if the beach is sampled at the Antrim Creek Natural Area? Lake Michigan.
No, it's not. I can answer that. It's not, that one's not sampled. And we have lots of, even this is a big list, but we have lots and lots of beaches and we just don't have the funding to, sample everybody.
So if I had a volunteer that took a sample and turned it in, it could still be tested?
Oh, yeah, absolutely.
Does that happen? Is that a thing or not? And the reason I bring it up is because the last 2 years, the amount of people at the natural area has almost doubled.
Oh, really? Okay.
And one of the maintenance guys was telling me that he went down there on a weekday in the morning. He wasn't expecting to see a whole lot of people. He's like, I was down there for 2 hours and there were 21 cars that came by.
Can you fit 21 cars in the parking lot down there?
We actually added about 9 parking spots
Oh, wow.
last year. And so between the north and the south, I think there's room for about 40
Okay.
altogether. But
So that might be, I mean, in the off season when we're done monitoring beaches and, we have our regular, Mark Drent is one of them, that collect samples and we can talk to them and say, okay, what beaches, what are you seeing? And they're there early in the morning, so they don't always see like when it's super busy. But it's something that we can look at like, hey, should we drop a beach and maybe add Antrim Natural Area? Because that's good feedback to know that has become more popular because that's what we want to do to give the biggest public health impact. is to sample the beaches that are most used by swimmers.
And I don't know. I'm sure there's other places along that you sample Lake Michigan. So maybe you say, well, we take a sample up in Charlevoix County of Lake Michigan. I mean, Banks Township is not that far from Charlevoix County. I mean, we border it. So I don't know the geography. I mean, I don't know if it's necessary, but I can tell you that we have a lot more people there than we
Mhm.
used to.
Mhm.
And not all of them swim. Some of them just walk the beach. Some of them hike the trails. We have a schoolhouse in the very middle of it now, and people like to check that out. So,
That's yeah.
yep, the north entrance, if you take Reckless Beach Road, you just keep go straight and you go right down to the lake there. Yep. They are supposed to remain on a leash, though.
So what I got from that discussion is we're paying Mark Drenth to go to the beach in the summer, and I'm gonna give him a hard time about that. when I
Right.
see
Yeah.
him.
You might want to give them a hard time. I
Yeah.
would like that job some
It's a
days.
great, it's a great gig if you can get it, right? One other comment,
No, go ahead.
oh,
Do yours first. You've been waiting for it.
one other comment that I wanted to recognize from the reports is a congratulations to Melissa Hahn and her team for achieving a 96% on the accreditation review. Good job. Thank you.
Good job.
Mr. Mason.
Mr. Chairman. Jeremy, piggybacking off from Jairus's inspecting, testing beach waters. So we have, and you'd have maybe a better handle on this if it's actually happening. We have a few of the lakes in Otsego County with no outlets. And so you've had the water up 3 to 5 feet, and it's anywhere from 2 to 3 feet yet in the basements after 3 years. Has there been some testing of like 5 lakes, Lake Manuka, and what are the results that have been? Oh, okay. So it would, you would, like Juris, ask the question with the test. Okay.
All right, board. Any other questions for our directors or Mr. Thorell? Moving on to item number 9, committee reports. Personnel and Finance Committee.
We
Ms.
need to make a
Levanway?
Motion to pay the bills.
Okay.
I will make a motion to, that's based on the Finance Committee's meeting. The board approved the June 2023 bills in the amount of $631,058.94. And the June 2023 employee expenses of $23,947.81. I need
There's
a
a
second.
second.
I will support.
Moved by Ms. Levanway, seconded by Mr. Ginnep. Any further discussion, Mr. Rubin?
Couple questions. I think I've asked about it before, but this agency, compared to the other boards that I'm on, we spend a lot of money on phones and cell phones. If you look in June, we're over 9,000. If you look in the next bills over, we're at 12,600. And I'm just wondering, it seems like a large part of it is cell phones. I'm just wondering if there's,
Well, when you break that out over 160 employees, I think it's fairly common for employees or everyone except my Amish friends in East Jordan to carry a cell phone. And if you're doing so in the course of your business, you expect the business to pay for it.
I mean, on some of my other boards, everybody has a cell phone and you just use your personal number. Do most of our people have two phones, their own personal and a health department phone, or how's that work?
Some do, because they are reaching out because of HIPAA,
Okay.
you know, the protected health information and reaching out to clients. They don't, you don't want to necessarily reach out to clients and have your own cell phone number out there. And we are, constantly evaluating and trying to save money because it's a big expense. I get that. And we're often looking at that to see what we can do to reduce that number. I think we are, in the midst of going with a new, office phone system, which we're hoping to, possibly even eliminate some desktop phones, because you could basically have your office phone number ring to your cell phone through this new system. So, I mean, that's like an example of a way that we're looking at trying to, save money with phone systems. And that's, Tim Hella, who's our IT director, sitting over there. If you have any questions about that, he can give you more detail, but
Roughly how many of the staff have a work phone? Roughly how many are on this plan, I guess is what I'm asking.
as far as the cell phones go,
Yeah.
I don't know the answer to that.
Am I on? Can you hear
There
me?
you go.
Thank you. Mr. Rubin, we actually went through last year when I came on board, and it wasn't even me that asked. Our staff is very conscious of this. We went through, and there's a stipend for those that are expected to use their personal cell phone. It's cheaper to pay a stipend than it is to buy somebody a cell phone and pay for the monthly plans. So we went through and we kind of re-looked at that and said, you know what? Not everybody on this list really needed to be on it. And it was tough. I mean, there were some unhappy people that had gotten a stipend and were no longer going to get one. But we look at this regularly. The other thing that's mixed into here that I do want to bring to light is that some of our vaccines they're in coolers, and there's a, what do you call it? Like an alarm on it. And if that cooler gets below a certain degree, we get phone calls sent immediately to staff, and we have to pay for that service. And it comes through the communications and the telephone numbers that if that vaccine gets too warm, so to speak, we've got to get there and get it out of there as fast as possible so we can keep the vaccine safe. So that's also tied up into some of these phone bills that you're seeing.
I think the other thing too, Shannon, that we talked about is that with all the different buildings all over, you can't get the same phone service everywhere. So that's why there's so many different phone companies in these bills, because you might not be able to get AT&T somewhere on the other side of the state, but you can here. And that's why you see so many.
Thank you. Yes, that's a really good point. We have many buildings and not all the same service.
And then in the middle of the page, CADCA, we have mid-year training conference for 3 staff and 12 students. Just curious what that involved.
That's through the SAFE and RISE in Otsego County. So I believe that's funded through the liquor tax. Or maybe Kathleen, can you?
It's a requirement of the CADCA funding that they receive to go to the conference.
And what's CADCA stand for again?
I will have to look that up.
Yeah.
Teaching the kids how to run these coalitions.
Yeah.
Right. So they go to a national event or conference every year as part of that certification, which is part of this group, for SAFE and RISE.
Okay.
Yeah.
Then the middle of page 2, $8,000 for KSK consultancy community listening. Is that the report that we're waiting on for next month, or is this something different?
That's the contract with the consultant that is doing the listening sessions and then working on the report, which we'll get.
So is this the total amount for the contract, or are we going to be seeing more?
I
more bills?
believe.
That-
Is that it?
I believe that's it. Yep.
Okay.
And then, on the very bottom of the report, there's 3 checks that were voided and we're not reissuing, and one of them is over $1,000. Just curious on the story on that.
I'm glad you asked about that because I made a note of that just in case you asked. For the $1,000 one, it was a clinic refund. Well, I'm sorry, the dental clinic refunded somebody's credit card and the check was never mailed out because they had already gotten the payment.
Oh, okay. All right, thank you.
Welcome.
We have a motion and a second. Any further questions or discussion? Hearing none, can we have a roll call, please?
Commissioner Levanway,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Hankins,
Yes.
Commissioner Rubin,
Yes.
Commissioner Ginup,
Yes.
Commissioner Mason,
Yes.
Commissioner Mapes,
Yes.
Commissioner Chamberlain,
Yes.
motion passed.
Thank you. Program and Evaluation Committee.
No. We have another motion.
We do have another motion. You're right.
I'll make that motion. I make a motion that based on the Finance Committee's meeting, the board approved the July 2023 bills in the amount of $568,163.58 and the July 2023 employee expenses of $28,525.44.
I believe in your motion, you stated 568,163. It should be 173.
Oh, sorry.
That's all right. I just wanted to make sure that was corrected. I'll second that motion. Any further discussion there?
On page 2, June and July internet for $5,623. I know our county is redoing our internet and we pay like $1,300 a month, and I'm just curious why that's high, or if it's not high, if that's normal.
That's normal. We have multiple buildings. We forget that we're not just one building. So we've got 4 main offices plus dental clinic offices. So that's
So this
just-
is all the dental clinics involved in here too?
Yep.
We have a motion and a second. Any further questions or discussion? Hearing none, can we have a roll call, please?
Commissioner Rubin,
Yes.
Commissioner Hankins,
Yes.
Commissioner Ginup,
Yes.
Commissioner Mason, Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Mapes,
Yes.
motion passed.
Then we have the amended fiscal year 23 budget. You have a memo from Shannon explaining it. We had a meeting prior to this meeting for the Personnel and Finance Committee.
I will make a motion to move that the fiscal year 2023 budget amendment in the amount of $34,054,383 be accepted and approved by the Board of Health.
I will second.
Moved and seconded. By means of further discussion, we have, the upside is we have a surplus of $134,000. Which is not always the case. But we are amending our budget, or we would be voting to amend our budget to reflect increase in revenue and also some increase in expenses, mainly through the dental clinics north. We've had more services provided, which has generated more revenue and a different collection system. And as a result of more services provided, there's been more expenses as far as staff members and supplies. Is that a quick?
That was perfect.
Thank
Yes,
you.
keep going.
Okay.
Someone was paying attention.
I know.
Mr. Rubin.
So I guess my question is, do you have approximate number of how many dentists we added, or? I mean, over $2 million each way. That's a lot of money.
So there's 2 factors into that. One, we are now mostly fully staffed. And then the other piece to that, you have to remember, we were coming off of COVID, that nobody was going to the dentist. Our services were not being used. We're coming back up, and we've seen the trend for the last couple of years, but we're back to kind of what I would call the normal after the pandemic. And so that's factored into that increase that you're seeing. The other piece to this is there was a change in the reimbursement rates that we received that took effect January 1 of this year, 2023. So we used to, let me back up, about 80% of our clients are Medicaid patients, and we would receive less for treating those patients than we would if we filed it with a private insurance company. On January 1, they changed that. And now, regardless of what the insurance is, you're paid the same for the procedure no matter what. So that increase is also what you're seeing. And it's been pretty significant because 80% of our clientele is Medicaid patients. So it's twofold. It's more staff, more services, and a higher reimbursement rate.
So this $134,000 to the good, is that going into the dental clinics fund, or is that going into the health department fund?
We have two options. One is HDNW provided a loan to get three. Wrong, you correct me.
I think it was 350, but
Okay.
Yeah.
So around that amount, it has not been repaid. So we would like to see something going toward that loan to get the balance to come back down. The other option would be to put it into the fund balance. If you remember last year, we had to dip into the fund balance to cover the legal settlement expenses that we had seen. So we will have to discuss that when we get to year end. This is just an estimate. This is not a guarantee. So once we close the fiscal year, then we'll have to meet and make that decision.
So Dental Clinics North has been around for over 20 years. And it hasn't paid back any of the loan that we gave it to get it started.
Oh, I didn't say any of it,
Oh,
but
well, I
there's
just-
still a balance out there
Oh,
that we
and
would like it to be
just to
repaid.
clarify that, it's when, so it used to be Dental Clinics North has been, you're right, has been around for quite some time with the health department operating Dental Clinics North with the buildings and our staff providing some backbone services. And MCDC used to staff it. Well, then the arrangement with MCDC ended, and Dental Clinics North, the nonprofit, right, that has all the dental staff, was started about 5 years ago. And that loan was to get, basically make payroll like the first month until they could get operational and start billing and all that stuff. So
So do you know what the original loan amount was?
about 350,000.
And have they paid any of it back or not?
Well, the idea is that they were going to start paying it back after like the first year, but then 2020 hit and all dental services were shut down by the state, so I mean, basically 2020 was a terrible year for dental operations. It doesn't matter if you're Dental Clinics North or a private dentist. And so it's taken a little bit of time to get back on their feet. And now that we're operating at a more normal capacity, that's why we're saying, okay, let's start chipping away at this loan that was given to get started.
Yeah, and that's the reason I mentioned it, because 2021 was my first year on this board. And dental clinics lost money that year.
Right.
The next year they gained money. And the last ones I saw, they had improved even more. So
Yeah.
if you are in a good fiscal position, it's definitely time to pay off your debts and your loans.
Absolutely.
And the last time I saw their position, they had over $1 million to the good. So I would love to see them pay it off.
That's the thought. That's what we want to see too. So.
Okay. Any other questions for Shannon on the amended budget for fiscal year 2023? Ms. Levanway, you look like you want to make a motion.
I did.
You already
And
did.
Rich did.
You did. I'm sorry. That's right. That's right. Okay.
Otherwise, yes, you're correct.
We have a motion and a second. Any further discussion? Hearing none, can we have a roll call, please?
Commissioner Henkins,
Yes.
Commissioner Mason.
Yes.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Ginup,
Yes.
Commissioner Rubing,
Yes.
Commissioner Mapes.
Yes.
Motion passed.
Thank you. Ladies and gentlemen, we've been here for an hour and 25 minutes and it's time for a brief
Wait,
recess.
before
What?
we go on.
Yes, we're not going to go on. We're going to take a brief
No, we have
recess.
to discuss something before we go on.
Oh,
In our
yes.
committee meeting, we discussed the budget. And one of the things we talked about is before the next board meeting in September, the finance committee is going to meet over the draft budget. But we would like to have a special meeting for the fiscal year budget for next year. And Shannon would like us to have a special meeting date the week of September 18th. So we
Can-
need to look at our calendars.
I appreciate what you're doing. Let's bring that right up after our 10-minute
Okay.
recess. Thank you. All right, we'll call the meeting back to order at 11:35. Commissioner Levanway was talking about our schedule for budgetary purposes. The Personnel and Finance Committee did meet. We talked about the fiscal 24 budget. And there's probably a need. We as a committee recognized a need for at least one more meeting. Here's the way it works, folks, schedule wise. September 5th, we have our regular Tuesday or first Tuesday HDNW meeting. By September 30th, we need to have the budget in place. So, and it's a $34 million budget. We're going to have some questions. We're going to want to understand some things. So I think the general game plan right now, and Shannon, correct me if I'm wrong here, was we will be given the draft budget on September 5th. But we wouldn't have another meeting, another regularly scheduled meeting until October then. It needs to be in place for September 30th. So looking at our calendars briefly in there, we had talked about potentially either September 19th or September 26th, having a special meeting for discussion of, that would give us a couple of weeks to look through the budget. We could then have the meeting to go through the budget, have any questions answered that we might have, and then have a formal vote to authorize that 2024 budget. That's what Commissioner Levanway was referring to. What's your pleasure, board? Commissioner Levanway has already said that she cannot attend the 19th. My only concern is that if we don't get everything worked out, for example, on the 19th, and we needed to have yet another meeting on the 26th, I know you're all excited about coming to have us a couple of special meetings here, and if we wait until the 26th, that gives us 4 days. So, board, what is your pleasure?
Mr. Chair,
Sir,
I didn't Dan say that he wouldn't be able to be around on the 26th either, so just for.
you weren't present,
Information.
you weren't going to be present on the 26th, Dan?
Correct.
Okay,
Correct,
so
but-
For everybody's information.
okay.
Yeah,
thank you.
I
Yes.
guess with that being said, and I don't know, this is new information for some of us here. I mean, I was in the committee meeting, but for Holly, if she could be here, or, I mean, Shannon, would be here. So, I mean, if I can't be here, we can cover things. I mean, don't let that be the deciding factor, I guess is what I'm
Okay.
saying.
Thank you.
Okay. Thanks, Commissioner Turnbull, for bringing that up. I had forgotten that, and thanks, Dan, for your clarification there. I'm sure that Holly and Shannon probably can answer the questions. It is nice to have you present at the meeting. I get that. The same for Commissioner Levanway. She has a conflict on the 19th.
And well, just one more thing too, before you go on, is I could probably remote in.
Oh.
too.
Okay,
So if there was something that came up that I needed to speak to or whatever, I could do it that way.
okay. Anybody else have any input into the potential scheduling of a second meeting on the 19th? How does the 18th look for you guys? I don't know how your county schedules look or your work schedules, et cetera, but how does the 18th look?
Thanks, good. I mean,
18th works for you, Don? Dan?
I'm looking.
Okay. Mr. Rubin?
Yeah, just a question. It seems to me that we're the 1st of August right now. Is there a reason we're trying to push it out to September? That's a little closer timeline than what I
understand that the question is a legitimate one, and we talked about that in the meeting prior to this one. For the finance team to be able to provide us with a good draft, they needed more time. And Shannon, I don't want to put words in your mouth, so I'll let you respond to that.
Oh, I appreciate it. You're on the right track for sure. So we just did the revised agency budget for 23. We also we're closing Q3 and Q3 FSRs, which is the reporting that goes to the state for all of our grants, are also due yesterday, actually. So my team has been inundated with deadlines right now. Historically, my understanding, I've been told, is that we do this revised budget and then you do the 24 budget after. And I've been told that it's even been done in the same month. It's also been done both in September. I would prefer to bring you the revised version a month ahead and then September bring you the 24 budget. I will also say this historically, and I know they were in a pinch because they didn't have anybody in my role at the time. They took the previous year's budget, added 3% and called it good. I don't want to do that. I want it to be tighter. I want it to be cleaner. So I have asked all of the directors here to send me 2-page budgets for every single program. And they've all done that. And it's a huge ask. And I know I asked a lot, but they've all done that. I'm waiting on closing up one piece left. And then I'm going to go through everything and we're going to put together the entire agency budget with all of the information that we have at the time to make the best budget that we can based on what we know. I will also say that you have to remember we are significantly grant funded. So most of our funding comes in and there's specific things that it goes for. It's not like we have a bunch of discretionary dollars, but with those grants, they come from the state, and the state is right now, they just passed their budget, but they haven't figured out all the details and how much we're going to get. And you remember that in Dan's report earlier. So what we get from the state is, yeah, we're going to go ahead and fund that project. And we say, okay, how much? They say, well, just use the amount you used from last year for now, and then we'll figure it out and get to you. So it's really, really hard for us to put together a solid budget when we don't even know what the numbers are going to be. So all this to say, this is why it takes us so long. And even the first part of September is tough to pull this together because we don't have all the definitive amounts and answers, but this is the best we can do for right now.
Do you think you're going to have the state information by late September?
No.
Or are we still not?
No,
gonna have?
no, we will not. This is why the other reason we always do a revised and amended budget partway through the year, because we just don't have it. Some of it will come in the state's fiscal years, about the same as ours. So some of it will come in the fall. Usually by December, January, we've got all the hard numbers in. And I'll be honest, it was December of this last year when some of them were finally decided upon. So.
It's frustrating. I'm with you, Jairus, and I was kind of pressuring Shannon in the previous meeting, like, hey, we need more time than September 5th to grab it and say, okay, yeah, let's vote on it. So that's why we're having this discussion on at least one more meeting in September. I had proposed just a minute ago, Monday, September 18th. How does that work, folks?
Mr. Chairman?
Sure.
The 19th, I have a scheduling conflict. The 18th would be wide open for me.
Okay.
So I think that'd be good.
I am good for the 18th. I'm good.
Okay. All right. All right. So, hey, We're making progress.
What time?
10 o'clock a.m. Does that work, everybody? That
Okay.
gives our staff time to check their emails and make the final copies and et cetera, et cetera. Let's shoot for 10 a.m. then on Monday, the 18th of September for a special meeting. Budget specific. And at
Chairman.
that meeting, then, if we don't get all the questions resolved or we don't have everything wrapped up, we could then potentially have another meeting the following week. Hopefully, we can get everything addressed between the 5th and the 18th meetings, okay?
Chairman, one question,
ma'am.
location,
I'm sorry?
location here or the health department? Didn't mean to put you on the
How many
spot.
people from the public are coming? Thank you, ladies. I was joking. Thanks for your vote. Okay. I believe we can be here. I will verify that with the county after this meeting, but I believe we'll plan for here. Okay. And if there is a conflict, I'll be in touch with Dan and we can then address maybe a different location if we have to. Okay. Everybody good? I wrote it in ink, so it has to be good now. All right. Now, Program and Evaluation Committee is next on our agenda. Grant review policy. Mr. Thorell, do you want to?
Sure. Let me find it. Bear with me here. Okay.
You're on. You're on, Dan. I heard you there. Yep.
Okay, there we go. Okay, so as you may recall, we had a couple of draft versions of a policy and procedure regarding the grant approval process, grant application approval process, and that was, we were looking at this spring. It was complicated. I was trying to mesh our internal process with the Program and Evaluation Committee process, and it just wasn't working really well and was confusing. And thank you for, there was a few Board of Health members that pointed that out, and I thank you for bringing that up. So basically, we had a Program and Evaluation Committee meeting on July 11th, and I presented this draft that's in your board packet to the committee there. Very simplified, just basically focuses on the process in the committee about looking at grant applications, and just, basically stuck to that. So it's more or less, one page. Looks like it bleeds over into a second page, but it's more or less one page, and pretty simplified. Basically, defining what grants we're looking at, how, it has to fit within our vision, mission, strategic plan, or our priorities, identified by the Community Health Improvement Plan, which is the Community Health Needs Assessment, My Thrive, that we do on a 3-year cycle. And then me requesting the Program and Evaluation Committee to review. We have the review form, which was already looked at and approved. And then, the scheduling about, basically that we need a minimum of 2 committee members, not from the same county, present. Just that was kind of like, if we could do that, then, may address some time issues, with trying to get an application approval, if we have a pretty tight timeline we have to meet. And just given that option, it's a committee, so in-person meetings are preferred, but not necessary. So we could accommodate virtually if someone could make it. And then, if we're not able to meet, then we just take the grant application to the full board at the next full board meeting or some, if we're not able to meet for some reason. And then, just basically the committee recommendation will be added to the agenda for the full board consideration at the next regular meeting. One important thing to point out is that that, given the wording from the last motion at the June 6th meeting, potential future grants are defined as any grant are defined as any grant funding opportunity that will result in the establishment of a new program within the health department. So that, potential future grants, that was the wording that was used. And so this is just kind of, given it that definition about what exactly that we're looking at. Because I wanted, if we were not saying that it was for the establishment of a new program versus not, I mean, if we were not doing that, then I'd want to have some dollar amount guidelines, because like for this next grant, or the grant that we're talking about regarding the purchasing the postcards, it's $900, right? I think we probably spent over $900, going through this process, which to me doesn't make a whole lot of sense. And this is for existing stuff that we already do. All we were doing is trying to offset some of our costs by asking the community, or the Charlevoix Community Foundation, to underwrite some of that. So with that being said, the committee agreed, and this draft was approved for the full board's consideration.
Mr. Rubin.
Yes. So Dan gave us this proposal. I have something to pass out, with a copy for each person. While that's going around, as the chairman of this committee, I looked this over numerous times since then. And I have 3 changes to his proposal that I'm passing out to you. I just want to make it streamlined, but also provide the oversight that our committee is supposed to have. So with your permission, I would like to read the 3 amendments to the original. Or do you want to read it yourself first, Mr. Chairman?
You can read the, this is the proposed revision that you would put on the draft.
Correct. So this would be 3 changes from the one that is passed out in front of you. So the first one, Dan already talked about a little bit, is under policy, potential future grants are defined as any grant funding opportunity that will result in the establishment of a new program within the health department or the renewal of an existing program. So that and the reason, the rationale for that is because there have been a few programs in the health department that have not been particularly popular with our constituents. And if we only look at new ones, even if we have a bad one, we never have the opportunity to review it. So then under procedure, Dan already talked about the vision, the mission, the strategic plan. I felt that fit better under number 2. And under number 1, I added the chair of the program and evaluation committee, understanding that if they have a meeting and the chairman can't make it, the vice chairman would be asked if he can make it, and that would be Mr. Chamberlain. It's good to have board input at a meeting, and we found out that we can't have 2 people of the program committee at a meeting, or else it's a quorum, so there can only be 1. And then under number 2, I added within a reasonable time, not to be mean to you, but the last one, this last policy Dan sent us the night before, and I guess that's probably why I'm proposing these revisions now instead of in committee, because I didn't have time to look over it. So I guess I would like to make a motion to approve this grant policy as amended.
Okay, there's a motion to approve the grant policy with the amendment presented by Mr. Rubin. Is there a second? Seconded by Mr. Mason. Is there further? Okay. Yeah, I got three different folks that want to have discussion. Holly, I think I saw your pen first.
I just wanted to make sure you thought.
Okay.
Yeah, so the amendment, I mean, basically the, the first one, or renewal of an existing program, the concern I have with that, and I think I brought this up before, is just the amount of grants that we have. And I'm concerned that it would be difficult to pull that off as far as like bringing the committee together to look at all of those. And get approval and then go to the board the board to get full approval and all of that. It's more of a timeline thing. I think, respectfully, I guess disagree a little bit, that if there is a concern with the existing program that we have, our current grant, I think, any board member could bring it to the full board as a discussion point or agenda point to discuss in a meeting. That I'm not sure that we have to go through this whole process if there's concerns.
Dan, couldn't we bring that up in the budget too? If you didn't like something, then you look at it
Well,
in the budget.
Yeah, I mean, we have, well over 100 grants, 100 and, would you say 16? Okay. And we listed that out in that, a spreadsheet that was sent to all the board members. And you're right, Commissioner Levanway. I mean, it could be brought up at budget time or anytime really, for the board to discuss.
The 116 would be ones that are
Required.
outside of the ones that are required.
No, that's like total. That's total number, which
Do you have a number of the ones? Because this says that they will not come before the committee if they're required by section 2433 of the health code or Act 368. So
right.
it's not 116.
It's in-
So do you have a rough number of how many we're talking about?
It's not taking those out, especially the 24th. I mean, there's the 8 that we talked about, the essential local public health services ones, but 2433, which I think at the last meeting I was talking about grant priorities in the public health code. It gives that broad, mandate to local health departments that shall prevent disease and prolong life and all of that. So that's much more gray, right? That's much broader as far as that goes. So yeah, if you take those things aside, that's most of the grants of that 116 fit in those categories, right? And we tried to delineate that, I guess, in that document that we sent out. So yeah, given that, those guardrails, I mean, it would be a much less number, a smaller number for sure.
Melissa, you'd raised your hand.
Yes.
Work under this policy. I just had a clarifying question. Number one, where you added, and I'm just trying to clarify because I'm not sure if I caught everything because we don't have copies of it. The grant opportunities are reviewed by the division director and health officer or deputy health officer, and the addition was and the chairman, correct?
Correct.
Okay. So my question is, this beginning part was to decide if we even, if it even made sense at all. So adding that feels like to me that if an employee came or I got an email about a grant, not using the discretion to say this doesn't really fit in our mission, this doesn't fit with where we're going, without contacting the board or the program and evaluation chairperson. My understanding was this first one was that we as directors, we as employees would really look and decide, because I get emails every single day about grant opportunities. And so then I make those decisions and, based on our mission, what we're doing, what I know about what we have as staffing and services. Would you really want me to be bringing every single one of those to you as well?
I think this just says that the ones that you want to move forward with, if you want to move forward with one, then you have a next meeting with Dan to make sure that he thinks that it's within the mission. I don't know how often you have meetings with the heads of directors to discuss these things. I mean, I'm sure it happens. And I
Right.
know grants have different cycles. I don't know if it's monthly or what it is. You can probably speak to that.
Yeah, I mean, we don't have, as far as new grant opportunities and things that we're talking about, I mean, it doesn't happen on, a weekly basis or whatever. But I think what, Melissa was getting at is that step one was kind of like internally, like, what are we deciding to go forward with, right? And then I think it's kind of like I think what you're talking about is kind of like a step 1.5, essentially between 1 and 2, where we would, bring it to the chair of the committee, but I guess I'm a little confused too, because let's say you said, no, we shouldn't go forward with that. Then you know what I mean? Like, do you want the full committee to be, reviewing that versus just the chairperson?
No, my thought was just to hear the discussion, not to offer input at that point, because if I or Josh is sitting in the room and you hear Melissa and you discussing a grant and
Mhm.
here's the pros, here's the cons, it just gives you a little more insight when it comes before the committee. And you can hear more knowledge and communication is usually a good thing. That was my reasoning.
Okay. Yeah. Yeah, I mean, I'll just have to, I understand your reasoning. I guess I would just disagree on the operational part of it, just because I think as being the health officer and our, directors and whatnot, there's a certain amount of trust that the board should, give to the leadership staff to look at those things, knowing what what the board is looking for, and then just bringing it to the committee. And part of that is from a timing standpoint and just also logistics and just things of that nature. I mean, sometimes we don't have formal conversations or meetings set up to review grants because, I mean, you may, and I've heard comments otherwise that we're going after grants all the time, which is really not the case. We are very thoughtful and conservative about the grants that we're going after. Even you may not, there's some, like you said, that you were not, necessarily happy with, which I understand. But it's not a totally a regular thing. But I also think that the board should give, the administrative staff some trust to, basically vet those and then bring them to the committee is the way I'm looking at it.
I want to weigh in real quickly here too. I think it's important for the board to remind ourselves that we don't do the day-to-day operation of the health department. That's done by Mr. Thorell and his directors and their staffs. So, and I'm just using an example, because you spoke last, Melissa. Let's say Melissa emails Dan and says, hey, here's a grant opportunity. What do you think? That's an interoffice email that I frankly don't want to be involved in. Okay. It could be, hey, Dan, what are you doing for lunch? Or it could be, hey, Dan, here's a grant opportunity. What do you think about this? I think that's the level of the level of trust that we have to put in these well-trained and highly paid staff members. That was a joke on the highly paid part, Okay, but I'm saying I don't think it's our role as a board to really delve that deep into the day-to-day operation. I think we need to have more of the 10,000-foot view, not the 100-foot view, if that makes sense. I understand your motivation in wanting to be involved, and I actually appreciate the fact that you want to be involved. You take your role very seriously. Okay. But I think from my perspective anyway, I think that's maybe getting a little too deep into the day-to-day operation. That's just my take on it. Mr. Mason.
I think where Jairus is going with this, now, we cleared the air, Dr. Myerson and I spoke during the break concerning, expedited parking. There's absolutely zero funding going into that from the grant. And unfortunately, the state mandated it on top of it. But we very much stumbled into something last October. That would be one of the grants that already existed in schools. And that's one of the, this is where Jairus is going. It really probably involves, who knows? Maybe there's not another grant like that. Maybe there's 15 or 20. It's really looking at things that should we be doing with the health department that, that grant goes away. It's gone away now. It won't be there in September. And I think that's good for the school, for the parents. That we're probably very unaware. We were certainly unaware of what was going on. I had no idea when I asked the question. I think what Jairus is after is being able to put those things under the microscope that most of us don't see. I think he's justified. Program. Could be things out there, Dan, that were there before you were the administrator. Nobody really gives thought of the money's there, the grant's there, the use of that.
Okay. Can I make, or just say one thing? I would just say, and I appreciate that, Commissioner Mason. We do have that spreadsheet, list of grants, so that we sent out and have met with the committee and sent out to all board, all Board of Health members. So you can see, what grants we have. I think this policy, was really, future, potential future grants. So grants moving forward, that would result in a new program would capture exactly what you're talking about. If, to have that opportunity for a Board of Health member to look at or review and approve whether we're applying for a potential future grant that would result in a new program without bogging down the other operations of the health department. Like, for instance, we did not have this policy in place. So this next grant with Charlevoix Community Foundation, I mean, that's for an existing program. And like I said, it's $900. And had we had this policy in place, we wouldn't be bothering the Board of Health with this. We would just be applying for that money to help pay for that program and doing it. Because it's an existing program that you are aware of, based on the information that we're given and based on approving the budget and all of that. So, and I think, going forward, I mean, I think this policy, as I wrote it, is in putting that guardrail on there about, new programs is effective. I don't, like I said, I mean, if there's something that pops up that you see beyond that, I mean, you could say to, Mr. Hankins, hey, I'd like to put this on the agenda to discuss at the Board of Health meeting. And then you can make a motion to do something different with it if that is what you chose to do.
I would like to ask a question. Jairus, why did you call another meeting before this board meeting if you had these issues? You're the chair. That was July 11th.
Yeah, I didn't have time before to schedule another meeting and get,
Then this shouldn't have came to the board. If you had issues that you did not talk about in your committee, this should have never came to the board.
well, we can still move paper.
We wasted half an hour already. I would think that if a committee brings something to the board is something that would be recommended. And I would hope that we change this so it doesn't keep happening.
Mr. Mason.
Rules that you follow allow that something like this can take place in a meeting without having to have it blocked.
But-
It's here for discussion now. And it has every right to come in this form. If you're following Robert's rules, it's there. It's suggested. You could have done it after the. So I don't think we had a motion yet on what Dan was discussing. But he could have certainly spoken to it at the time of the motion. He had the opportunity then to introduce this. He's done it just ahead of the motion.
Actually, we do have a motion in a second to approve the grant policy as amended.
Okay. Yes, we do. It's there and it's there legal. Not a good parliamentarian.
Yeah, that's not my issue. My issue is there's a committee to work on this. And if Jairus had these issues, he should have brought them up. And he said he got this a day before and didn't have time. But since July 11th till now, he could have called another meeting. That's what I'm saying. If he had issues that he wanted to talk about, they should have talked about it in the committee and agreed upon it or talked about it, than to just bring it to the people that work here and say, this is what I'm going to change it to. That's what I'm trying to say.
This full board has the right to hear this in its proper order, not out of order.
Well, we have
I'm
a
not
process of how our
justifying why he
committees
did it.
work, and that's not our process, is what I'm trying to tell you.
Okay, is there any further discussion or question? Ms. Glenowski?
I don't have a copy of this in front of me. So Jairus, I'm going to do my best to interpret what I believe you said. And I want to go back to the section about the policy and the renewal of an existing program. I'm starting to get a little panicky over here, to be honest, because you just asked me to put together a budget in a very short time frame. And I've told you that I don't have all the numbers, but I'm going to do my best to get it together for you. And now you're asking to review all the renewals of existing programs. And as I'm putting together this budget, I'm looking at all 160, however many grants we have, columns of program codes that we have. And I've got a 2-page budget for every single one of those. And if you want to review all of the existing programs before we renew them, there's a number of these throughout the year nonstop that are going to be coming at me. And even though this goes to the program committee, it still has to have a piece of finance review, right? Like somebody's got to tell me what's going on or what it is they want. So I'm going to have to take some of my time somewhere to review all of these and prepare it so that it's in a format that you guys can review and have a discussion about. And I'm happy to do that. But I've also got a budget that I have to take care of. And I've also got a number of other things on my plate. And this is going to increase my workload significantly, almost to the point where I'm sitting here thinking, you're going to have to tell me what you want done and prioritize it, because I can't do it all. And I'm happy to do whatever it is that the board asks in the will of the board. But you're starting to push into my workload to the point that I can't do it all. So I just want to put that out there so you all are aware that this is the consequences of this piece of it. Thank you.
Mr. Rubin?
Yeah, I think I mentioned to Dan already that this is probably about 20 grants. I don't know where you get these big numbers of 100 and some. There's about 20 that do not fall under the scope of section 2433 of the health code. So my goal is by no means to be looking at all the grants. There's grants that fall under the code that probably should be looked at, but that's not what this policy is about. This policy is very limited. I don't think it should cause you to be worried about how much work it would be. We've already done it a couple times. This isn't strange. All of our grants that we have at the county level come before us. If they're renewals, they still come before us. Last month at Antrim County, we renewed a grant that we do with the FBI. So I don't see that this is anything out of the ordinary.
We also provided a grants listing. So I think, Dan had mentioned that if there were questions, I mean, bring it to us, come talk to us, ask us. We're happy to talk. But this is, I guess I'm not sure how you're getting the 20, because when I look at all of our programs, and I'm going back to my budget spreadsheet, which is flashing through my head right now, there are programs where they're funded by multiple sources. So, when I'm looking through these programs, now I'm going to have to look at, okay, I've got fees and collections, I've got federal funding, I've got state funding, and I have a grant funding piece. What's the deadline on that grant funding? When does that expire? When do we have to bring it forward? And I know the directors are going to be watching just as closely, but it takes a team to keep this ship afloat. So I guess that's my concerns is you have a grants listing. If there's current grants that are in question, please bring it to us. We're not trying to do something you don't want to do. We want to work with you.
Yeah.
This deck, bit of a program process, is it something that would take place over a period or so? If you've got grants that come up. Stay over, some of them are 1 year, some are 2 or 3 year gap. Is this something we would be looking at over a 2 or 3 year period? So that you're really not overloading the system, but because you're talking if there's 20 grants out there, you're talking over a period of years. Nothing in government happens. That maybe the start of war. Even that.
So I would say here too, that we're creating a policy. And Jairus, what I heard you say was this is more situational, not your words, I'm paraphrasing, but this is more situational and there's 20 to 30 grants really that need to be considered, but words mean things. And if we are putting a policy in effect, then we expect our staff to follow it. And this policy may not, if we put this policy into effect, until this board would change this policy, everything has to follow that policy for staff. None of us may be here when this issue comes up. So I think the language or the renewal of an existing program, that's a pretty broad approach. And that's why I'm resistant to the changes that you're proposing here. Because Shannon is correct in saying, okay, if you want to review every existing program, we need to duplicate her.
And me.
And, okay,
And me.
so,
But that's the whole point. It's only the ones that fall outside of Act 368. So it's not every.
Right, but.
And the whole rationale that started this is last winter, like Mr. Mason said. We had a grant that would still be going on now, would never been brought for renewal, that the vast majority of this board did not approve of. And if I'm a staff person, I've gone through and gotten this grant. We're in the process of doing it. And now I find out my board doesn't approve of it. That's not a comfortable situation. My whole rationale is I'd rather have them tell me right up front and I
Okay.
can send my efforts in a different direction.
okay, but in the proposed policy that Mr. Thorell put forth, paragraph 2 under procedure does put it before the program and evaluation committee for grant submission.
But not if it's a renewal.
Should we table this entire thing and go through rewording it more specifically, because we're going to have confusion here in this, voting. I think as it is. We've gone this far, Dan, if you object to maybe working with Jairus with the rewording of this motion.
But I think it would probably the proper procedure would be to bring it, I mean, it would be at the board's discretion to bring it back to the committee to continue to work on it if that is, if that's the will of the board, for sure.
But we have to address the motion that's been moved and seconded before we do anything further. So is there any further discussion that needs to take place before we vote?
I have a question. So because this version, my version, so to speak, that was recommended by the committee, voted on, recommended. So wouldn't the board have to vote on that?
Well, the motion that was made was to approve this policy and procedure as amended by Mr. Rubing's amendment here. And it was seconded by Mr. Ginup. So we need to address that motion first, then we can pick up that question, I believe.
Okay.
Okay, so I gave you an opportunity. I'm going to call the question. The motion that's before us is to approve the Health Department policy and procedure for grant renewal as amended by the amendments presented by Mr. Rubing. So a yes would be to approve that policy with these amendments, a no would be to not approve. Mel, can we have a roll call, please?
Commissioner Chamberlain,
No.
Commissioner Hankins,
No.
Commissioner Levanway,
No.
Commissioner Mapes,
No.
Commissioner Ginup,
Yes.
Commissioner Mason,
Yes.
Commissioner Rubing,
Yes.
Commissioner Turnbull,
Yes.
tied.
I
Motion
believe that's
fails.
4-4, so the motion has failed. Okay, now. Dan, restate your question on the policy that was presented.
So the committee, I don't have the committee minutes right in front of me, but I believe it was approved. The policy in the committee was approved.
This draft policy that you presented?
Right. Do you
Okay.
have the copy of those minutes? In your computer? Okay. Basically, I mean, I'm paraphrasing, but if we want to hear the exact motion, it was moved to recommend to the board to consider the policy for approval.
Okay.
Is that your recollection? Okay.
Okay, so Mr. Mason had an interesting idea a little bit ago about tabling this, because I think if we make a motion to approve this draft policy as presented, we're going to have the same vote that we just
Mhm.
had. Okay, I think it's going to be 4-4. Now, that's just me looking into the crystal ball. I'm
Sure.
could be entirely wrong. But
I just didn't know procedurally what is supposed to happen with a motion or with a recommendation from the committee, if that has to happen or if it doesn't, or,
You can take it, you can change it, or you can leave it.
okay.
was the committee recommendation, it was passed to move this proposed policy to the full board?
Yes.
Okay. So recognizing then that vote, I'm going to make a motion that we approve the draft policy for grant review that is dated 7/9/2023 that's been presented to us by Mr. Thrill.
I'll second.
So it's been moved and seconded. Is there any further discussion? I want to recognize the committee's authority here. So, all right. Let's have a roll call, please, ma'am.
Commissioner Hankins,
Yes.
Commissioner Ginup,
Could you repeat the motion, please?
You know what? I'm the one who said we need to write them down and I didn't. So I'm gonna write it down. I move that we approve the grant review policy and procedure that's dated 7/9 of 2023. That's in our packets today.
That was presented by the committee. Or approved by the committee.
Thank you. No.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
Yes.
Commissioner Mason, Commissioner Rubing,
No.
Commissioner Turnbull,
No.
Crystal ball was right.
My crystal ball is accurate.
motion failed.
Okay. So I guess it's kind of a back to the drawing board situation for this committee. And for Mr. Thrill.
I would ask Mr. Chairman to, and your assignments. And be more specific than, more specific.
Yeah, absolutely. I mean, we'll work together to try to come up with something that we can both live with in the committee for sure. So.
Okay, so next up on our agenda, we have the Charlotte County Community Foundation Unmet Needs Grant for SNAP postcards. That's in your packet as well.
Okay, so this, at the same Program and Evaluation Committee meeting, back on July 11th, this, was considered, and again, this is for the, SNAP program postcards, reminder postcards that are being sent out. And I should specify too, like this grant, it's a new grant, future potential grant, for $900. It was to offset, printing for these postcards. This is not, this was not a grant that was gonna, basically prevent us from doing this. It was more or less to offset the costs. So we were still going to do this regardless. We just wanted to apply for, some extra funding from the community foundation to help cover the costs for the postcards for Charlevoix County to send out to, SNAP beneficiaries to remind them how to best use their benefits, especially at farmers markets. And it lists all the area farmers markets to where they could go to and the dates and all that, to make sure that they could, utilize their benefits to the maximum potential. And the committee approved the motion to recommend the Charlevoix County Community Foundation Unmet Needs Grant for SNAP postcards of the full board for consideration and approval. So the vote was to recommend that it be taken to the full board for approval.
Thank you. Would anyone like to make a motion?
I'll make a motion to approve the grant.
Okay, been moved by Mr. Chamberlain to approve the SNAP postcards grant. Is there a second? Seconded by Mr. Mapes. Any further discussion?
Mr.
Rubin.
Chairman.
Mr. Rubin first.
I voted against this and I guess I'm still opposed to it. There's a whole bunch of parts in here that just don't make sense to me, but I will say this. This grant partners with DHS. And recently DHS gave their report to the Antrim County Commissioners. And their mission statement is the Michigan Department of Health and Human Services strives to promote better health outcomes, reduce health risks, and support stable and safe families while encouraging self-sufficiency. I feel that this grant encourages you to sign up for SNAP or to get onto a government program, not to encourage self-sufficiency. And that's why I'm opposed to it. Okay, Mr. Turnbull.
Mr. Chairman, I would like to ask Mr. Thoreau, I asked if we would be able to see the postcard that would be sent out to these people. Was that sent out to everybody and I just didn't see it? Oh, that's a bad blind joke, sorry. But But in all seriousness, I didn't know if he was able to send that out so people could, we would be able to take a look at what would be sent out to these individuals.
I apologize. I don't recall being asked
Okay,
that.
no worries.
Yeah. For everybody to see that. If that was the case, it was my bad.
Any other questions or discussion, Mr. Ginnett?
I'd like clarification. You said that you were going forward with this no matter what. So you're just asking for a reimbursement?
Yeah, I mean, more or less, you know, it's a minimal amount, $900 to help pay for offset the cost of printing these postcards. We're, you know, regardless if this was coming up or not, as an opportunity, we were going to do that as part of the program because it's an important part of notifying, and we're not trying to solicit new people to come to that program. It's letting the people that are already signed up know how best to use their benefits and connecting them with the farmers markets, is basically the premise behind it. So this just would, you know, this would just help offset the cost of doing that printing and, you know, free up additional funds. Because every time we use grant funding, we can match it through Medicaid. So it just allows us to basically maximize our funding. I mean, you know, it's, you know, a really good way to utilize that. So whenever we can do that with grant funds, we try to do that. And it's just, you know, kind of goes along with that whole piece of keeping local appropriations lower for all the counties and just, you know, being innovative as a health department. I mean, this is, you know, a perfect example of that. And if there's a funding opportunity, we're seeking it. And this is you know, again, you know, this is a private grant through Community Foundation, just funded by donors. It's not taxpayers' dollars. It's nothing like that. It's people basically giving money to the Community Foundation to give out grants to the community.
Mr. Rubin, go ahead.
So now I have a question. So if this board says no, you're gonna go ahead and do it anyway.
That's our intention. And the grant was not to, you know, basically print the cards or not. It was just to help offset the costs. It's an unmet, it's a Community Foundation grant. It's not a grant for a program or, you know, specifically tied to a service, so to speak.
Okay, that's very interesting.
Yeah, can I piggyback on that a little bit? It's just, you know, the way that the last motion from our last Board of Health meeting, potential future grant, it was pretty broad, right? We don't have a policy in place. And so we felt it was important to bring that grant to the committee for consideration.
Mr. Mason, well,
It's interesting. Now, there are three of us on this board that get information like this. Now, it doesn't include Otsego County. So we would see this particular postcard, but when that information is up at farmer markets, whatnot, we manage to get things in the mail. Money's out there to be had for farmers markets, for seniors, things like that. So, in my opinion, I'd love to see us $8,000. Everybody over the age of 65 is going to know about this. I think you'd be pretty surprised to find out that there were people that didn't know about it. So the word gets out there. This grew pretty quickly. Somebody knows somebody that spread that.
Yeah, and it's not just for the 65 and older. I mean, it's for everybody that is signed up for those benefits. It does, you know, it's not targeted to senior citizens.
okay, we had a motion to approve this grant application. It was seconded. Is there any further questions or discussion?
Mr. Chairman,
Sir.
I'd like to ask Mr. Dan if, do you have an approximate number of individuals that you're looking at reaching with this program?
I believe, do we have a number in there, Kathleen? Yeah, 1,065
Okay,
individuals.
that's all I had. Thank you.
Anything further? Roll call, please.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Hankins,
Yes.
Commissioner Mapes,
Yes.
Commissioner Ginup. Commissioner Ginup,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Mason,
No.
Commissioner Rubing,
No.
motion passed.
All right, thank you. Next on our agenda, we have unfinished business. There's nothing there. Under new business. Resolution opposing the statewide sanitary code bills. Mr. Turnbull.
Oh, man, I didn't write it down on my notebook yet. Just based on the information we discussed, Mr. Chairman, well, that Dan spoke about at our last meeting with regards to House Bill is 4479 and 4480 that would create an ordinance where every septic or sewer system has to be inspected once every 5 years by the health department. Mr. Dan seemed like he was frustrated by it because there was not much input from HDNW or well, the health departments in with this bill, saying that it's like not feasible, not something that would, so something that not only HDNW would very struggle with, I believe you said about approximately 40,000 homes that they would have to inspect up here. But in addition to that, the rising, the costs of it would come directly from our constituents, from the people, everyone that owns a house that has a septic field. I know I went around and spoke to a bunch of the people that I represent in Otsego County, and we presented this similar resolution at the Board of Commissioners for our county. It was passed unanimously because people didn't want to have to pay anywhere between 400 and or they said that it could be up to $1,500 for these inspections. Worst case scenario. And that was once every 5 years. And if you don't pass it, then you have to get a new septic system. And, that there you're incurring, in the tens of thousands of dollars. But, all this under the guise to, protect our lakes, protect our waterways. When Mr. Dan, they already have and correct me if I'm wrong, sir, but you guys already have a program in place doing just that, except for not every 5 years. I know when I purchased my house 2 years ago, the health department came out and that was one of the systems that they checked was my septic system to make sure it wasn't leaching into the ground or any other bad things, whatever they're inspecting. So worked with Otsego County Board of Commissioners. Like I said, we passed this unanimously. And then I spoke with Mr. Dan, asked him what his thoughts were. And he, I believe, took the a resolution that we'd passed in opposition to this and reworded quite a bit of it, to fit HDNW. So, and I believe it was in everybody's packet, so everybody was able to review it prior to this. So with that, and I apologize for not writing it down, but I make the motion that we approve the resolution in opposition to those two bills.
Support. Been moved and supported. I would note, actually, the resolution lists both those House bills and also Senate Bill 299 and Senate Bill 300 as well. So there are actually 4 bills that are listed in this resolution. Moved and supported. Any further discussion? I would tell you that Charlotte County is doing, I believe, the same thing at our next Board of Health,
That'd be
or
awesome.
our next board meeting. No further discussion. Roll call, please, Melanie.
Commissioner Mason,
Yes.
Commissioner Ginup,
Yes.
Commissioner Levanway,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Hankins,
Yes.
Commissioner Rubing,
Yes.
Commissioner Mapes,
Yes.
Commissioner Chamberlain,
Yes.
motion passed.
Thank you. Intergovernmental agreement with Torch Lake Township regarding septic inspection time of transfer ordinance. Mr. Fruit. We have it in our packet. I think we discussed it a little bit earlier. Is there anything you want to add, Jeremy? Thank you. Would anyone like to make a motion?
I will. I'll make a motion that we approve this.
Second.
Moved and seconded. Any further discussion? Mr. Rubin?
Yeah, Dan, I'm still confused because I was at the Torch Lake Township meeting. And the copy that I saw said 180 days. And
That's
now
what-
I hear 30 days. I would just like to know. I don't care one way or the other, but this
Me-
is an intergovernmental agreement and there's duties that we have to perform. We should know what day we have to start performing those.
In our email from the Watershed Council, they said it starts August 28th. That's what it said. So I don't know, Jeremy, did,
And then my second question is this almost exactly the same as Milton Township's intergovernmental agreement? Yeah, that's where it is on page 7, section 16, effective date. This ordinance shall become effective 180 days after approval. That's where I got it from. I couldn't find it earlier. Now it's staring me in the face, so.
Yeah, I don't know what happened there.
well,
'Cause
that number 1 of 14 appeals has 30. That's probably where you got that from. Under section 14 is 30 days there. That's probably where it got confused.
This is a hearing. They may
Right.
request a hearing.
That's
at
not, I'm
30.
saying that's probably where the 30 days, 180 days got confused. That's probably why people don't know.
I don't, it really, what matters is what they voted on, right? I mean,
Right.
yeah, so I don't know where the disconnect is, but if this is what they voted on, it says 180 days. So. Yeah,
No.
yeah. So I think they would have, I mean, they would receive pushback if, someone really wanted to, if they're trying to enforce it. And they could say, well, wait, this isn't going to effect for 6 months, so.
And my second question is, this is an intergovernmental agreement. At the county level, when we execute an intergovernmental agreement, we usually have a legal review. Was there a legal review done on this when we entered into it with Milton Township? Because there's no significant changes, but I'm just curious if there has been a legal review. And that was before your time.
It was before my time. I don't know the answer to that for sure, but I know that when that was going on, Jim Young was involved. So I'm 90% sure that there was a legal review done at that time.
Any further question or discussion? Roll call, please.
Could I ask a question?
You can.
On approving 30 days or 180 days?
We're voting on approving the
Intergovernmental agreement.
intergovernmental agreement, which ties into what Torch Lake Township voted on.
And very last statement.
It does, yeah.
Okay.
Okay, all right.
That's, yeah,
Sorry.
no, that's
Go ahead.
fine.
Now roll call, please.
Commissioner Ginup,
Yes.
Commissioner Rubin,
Yes.
Commissioner Mason,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
Yes.
Commissioner Hankins,
Yes.
Commissioner Turnbull. Commissioner Turnbull,
Yes. Sorry.
Commissioner Levanway.
Yes.
Motion passed.
Okay, that moves us to public comment. Same rules apply, ladies and gentlemen. You'll have 3 minutes to address the board. Please state your name and which county you reside in. Would anyone like to address the board? Go ahead.
Mary Lieberman, Emmett County. I have two things I'd like to address. One, I did attend the committee meeting for the programs and evaluations where the policy and the grant were both discussed. And as a constituent, it does concern me that a chairman would, although I respect he has a right to, and hindsight, to go back and look at what was recommended to come to the board and make comments and such. It concerns me to see him come with a prepared written statement that he passed out, not only to the full board, but to his committee members who were caught off guard with this as well and not able to even have time to read it. That concerns me. It didn't seem very appropriate as a constituent watching this happen. I hope that that doesn't happen when it goes back to the committee, because these people are putting in their time. And it seems like it's a fruitless endeavor because they get shot down every time they come and make a recommendation. I do appreciate that the grant was passed. On a second issue that I'd like to address, I really want to commend this leadership and the staff, both sides of the room, from the health department and the way they've conducted themselves in this meeting. It's the first time I've heard some of them really be given an opportunity to even explain the information in their reports. Even though they were challenged at times, they were professional, they were articulate, and they gave concise answers that people in the audience can understand and hopefully people on the board can understand. So I thank you again and hope the next meeting can go a little bit more smoothly.
Would anyone else like to address the board? Go ahead, sir.
John Swartout. So I gave you 5 reasons to be skeptical of the safety and efficacy of the fast-tracked COVID vaccines when they were given emergency use authorization by the FDA in December 2020. Were you skeptical? Or did you just trust the government? Here comes this miracle non-vaccine vaccine in record time, less than a year in development, an mRNA vaccine, which nobody ever had heard of. In fact, a vaccine technology that FDA had never approved before for a coronavirus previously known as a common cold, formerly held to be an unlikely candidate for a vaccine for a variety of reasons, not least of which is its habit of rapidly and repeatedly mutating. Oh, but we have lots of experience with vaccines. Not to worry, the FDA says it's okay. I beg your pardon. That's called normalcy bias, and it's potentially lethal when things are manifestly abnormal. Oh, but Pfizer says it's safe and effective. Oh, so I should believe Pfizer, the company that since the year 2000 has been guilty of 15 safety-related offenses, 10 healthcare-related offenses, 20 government contracting offenses, 14 competition-related offenses, 26 environment-related offenses, violations of the Foreign Corrupt Practices Act, kickbacks, and bribery. That Pfizer has paid almost $11 billion in fines, penalties, and settlements for their misdeeds since the year 2000. If Pfizer were a young man wanting to date my daughter, the answer would be, get off of my lawn. So why would I ever roll up my sleeve for a pig in a poke from Pfizer in hopes of heading off a virus that was fatal to almost no one who wasn't sick, obese, and over 80? But John, nobody said you had to take it. Indeed, I wasn't in the armed forces. I wasn't an airline pilot. I wasn't a healthcare worker at a facility receiving federal money. I didn't attend a university during the pandemic emergency. You're right. I didn't have to take the jab. But as my brother's keeper, I still take it personally that many others did. Once upon a time, first, do no harm was the first rule of medicine.
30
was-
seconds.
It was right there in the Hippocratic Oath, right in the beginning. Now I'm told that's an anachronism. They don't even teach it in medical school anymore. That's old timey stuff. I'm almost afraid to ask what they teach now instead. What happened to the practice of medicine and the institution of public health in this country? First, do no harm. Thank you. More next month.
Would anyone else like to address the board?
Hello, Marcy Boshane at Seago County. I do have a couple of things in regards to this meeting. I was wondering still, there was a question a while ago and I haven't made it to the past couple of meetings, so I don't know if it was ever answered. And that is, what do the people want in these court cases? Did you ever get the answer to that question is one of my questions. I would like to also know what they want in these court cases that we're spending so much money on. Let's see. To your evaluation of the website, and you reached out to people to evaluate your website, I encourage each one of you commissioners to go back to your own county and have some citizens evaluate your websites, because some of them are not great. In fact, most of them don't even have the proper information for you all. So I suggest you do that. I would also like this board to consider moving to other counties. You represent 4 counties, and I constantly have to drive over here. So and as well as my commissioners. So I am imploring that maybe you consider rotating around so that other constituents from other areas can attend these meetings. I did have a question from one of my friends about the the committee that went around and talked to different citizens, the grant one. And that was because there were 8 scheduled interviews with constituents. And then those were mostly, I think they were both sides, you know, they were diverse. And then there was a request for 8 more just by health department employees. And then there was one other one that was a full citizen one. So the question from this citizen was there extra funds? But I think I got the answer to that. The total grant was $24,000 for the entire thing. And I think she didn't charge extra for those other 8 sessions. So I think I got the answer to that. This board made it sound like it was only $8,000, but that grant was $24,000. Moving on.
30 seconds.
Okay, 30 seconds, then I need to spend them well. I would like this board to look into all the spraying that's going on around our communities. We are getting sprayed from the ground. The consumers are spraying all pesticides all down all of our power lines, not to mention the chemtrails you see all over the skies, not to mention all the logging that's going on, and they're spraying to get rid of hardwoods. So please look into the poisons that are coming from the ground and the air. Thank you.
Anyone else like to address the board?
Again, my name is Rebecca Otto and I'm an Emmett County citizen. And I wasn't going to do a second comment, but there are some things that I'd like to address regarding STIs and drug use in our community. Setting aside the fact that our youthful years are a time for experimentation and that the prefrontal cortex is not fully developed until 25 years of age, our historical way of dealing with youth, purity culture, and just do the right thing are not resonating with youth, and they are not making us approachable adults when they are struggling. So to that end, we are doing a training called Askable Adult that starts tomorrow and is also convening next Wednesday in Petoskey. It's being held by United Way, Women's Resource Center, and Planned Parenthood of Michigan. Yes.
What's the name of that program?
Askable Adult. Yep. And we are reviewing a lot of statistics. Yesterday, when we did our run through of the program, which my daughter sat in on and gave her input. My daughter is 13 years old, serves on a local nonprofit board, and is on the youth advisory committee for Planned Parenthood of Michigan. And she gave her input on some of these things, but the glaring of the conversation that we've been having is that in our country, youth ages 15 to 24 make up half of the 26 million new cases of STIs in our country. And so we have to address this in a different way. Other developing countries are hovering around 10%. And part of that is because the kids can come to the adults in their lives and have open and honest, approachable conversations. And that's what we're endeavoring to do with this training that we're doing. And we will be offering it again. This is not the first time. And so if any of you are interested in attending, please sign up online and I will let you know when other ones are happening. But remember that youth giving us their word on what helps to reach them is invaluable in this time, and we have to listen to them. They're not always going to do what we want them to do. It's very frustrating, but we are trying to find new ways of reaching youth, and listening to what works for them is an absolute first step that I credit the health department for keeping that in mind. Thank you.
Would anyone else like to address the board? Hearing none, we will close public comment. Commissioner comments. 3-minute time limit. Mr. Rubin, you're up.
Yeah, I've heard similar comments as to the one that was just made about youth and problems that they have. I spoke with a lady from Antrim County recently who said she was working with people who were severely addicted. And she pointed out to me that when you look at the 10 commandments, the first commandment is you shall have no other gods before me. And she said, a lot of times we don't realize that this substance or this addiction is their God. And it's the first thing they think about when they get up in the morning. And it's the last thing they think about when they go to bed. And I think our culture's continued decline is probably due to our total lack of regard for the 10 commandments. 5th commandment, honor your father and mother. 6th commandment, you shall not murder. 7th commandment, thou shalt not commit adultery. 8th commandment, thou shalt not steal. 9th commandment, thou shalt not bear false witness. And 10th commandment, thou shalt not covet. All enclosed in the second table of the law. God gave those to us for a better society. Thank you.
I have nothing.
Thank you, Mr. Kenneth.
I would like to personally thank each and every employee that we've come in contact with at the health department. I really respect you guys, and I think that you guys have had very professionalism, and I really appreciate it working with you guys. Thank you, each and every one of you.
Thank you, Rich. Mr. Mapes.
Nothing other than I second Mr. Guinness' remarks.
Thank you. Mr. Chamberlain. I'm good for today. Okay, Mr. Mason.
I just want to mention that motion that Commissioner Rubin gave us short, clear, easy to understand.
Okay. Thank you, Mr. Turnbull.
So I wanted to reiterate, I mean, just was talking to some of the religious, his views on religion and morality. That was the reason why I became a commissioner and why I appreciate y'all allowing me to be on this board. I did it in similar look at in Psalms 81. It's been a passage that I've been reflecting on. God asked us to, commanded us to defend the poor and the fatherless, to uplift the poor and the weak. And I think this is a great opportunity. I mean, the stuff that the health department here is doing is commendable. When they said, told Mr. Dan a few times back that I loved when we sat through and we started to go through one of our first meetings with the program evaluation committee. They started to go through all the different programs that are going on. And there were some I mean, really good programs that really get out there and help people. And that's what I love to see. And I mean, if it's, I hope it's not, disrespectful. It doesn't come up in any way when I ask like your numbers, like what are the numbers that you're looking to attain for this, like with the SNAP thing. That's, I love to hear it. Like when you're even one of the programs you talked about, an individual with mammogram screening, you had one person, you didn't have thousands of people come in. You mentioned you had one person that came in, screened, found a problem. She was able to get it fixed. And this individual's alive today because of this program. I mean, that's one person. That's enough for me. I mean, one person, it's beautiful. I mean, the numbers mean things. So I really commend the health department for what they do in these different programs. I look forward to seeing more and how you guys continue to get out there and do that. You're, you're defending the poor and the fatherless. You're, uplifting to the same individuals. So I thank you for that and let me be a part of it. That's all I have. Thank you.
Thank you. I have nothing to add right now, ladies and gentlemen. I would entertain a motion for adjournment.
I'll make that motion.
Moved by Mr. Mape, seconded by Mr. Ginnip. All in favor, say aye.
Aye.
Thanks, folks.
That hasn't been a- that's true.